Okay, everybody. Thank you for coming on a few minutes early.
Hi,
Hi, Carolyn. Hi. Hi, Renee. There you have almost a full screen. That's impressive. On a Wednesday night on September 1st.
Yeah. LJ, totally unrelated to the topic at hand. You guys may already know, but there are shortages of the lead care testing, whatever. So there's a possibility that we may run out and have to send out more labs that could affect the quality metrics or not. So I thought I'd just mention it.
Actually, I appreciate being made aware of that because I was out for a bit. I had not heard that. I will.
We personally haven't run out yet, but we're just being told that the supplies will run out. But since it's one lead test in 2 years, maybe it won't affect the quality metrics because I don't know how long the shortage will be. But
okay, I'll also do some. I'll put in a message to the team that we worked with in the beginning to set up the lead care testing just to understand a little more the scope of that. Thanks, Carolyn, for the heads up.
No
I
problem.
appreciate that. So I'll let everybody feel free to sign into the chat, introduce yourself that way as you're coming on. We'll give everybody wait till about 7:03 or so, and then we'll get started.
Hi, this is Dr. Breen from Dansville.
Hi, Dr. Breen. Thank you for joining us. Consider yourself signed in there. I'll put you in the chat. You're welcome. Again, for anybody who just joined in, go ahead and sign in the chat. Thank you so much.
I was in the office all day, so I just had to go and kiss my dog on the lips real quick. So I haven't seen him all day.
Perfect. I love that image. Your dog must be in serious withdrawal, Renee, when you're not there. It's hard for them.
Brent's home. He's not, in a crate or anything all day, but he misses the mommy. That's for sure.
Got it. So it looks like we have a few people who are on by phone besides Dr. Breen. So for those of you who are on phone, we're just asking people to introduce themselves in the chat. But if you want to just tell us who you are, we can stick you in the chat since you can't from your phone.
Hi, LJ. It's Sarah Doverty.
Hi, Sarah. Thank you. I'll put you in the chat. Excellent. Well, we have moved on to a second screen. So I think that is perfect timing for starting. And we'll let others join in. So we decided to keep tonight shorter and less formal for the agenda this evening, because it seemed like it was just an important time to have a meeting and allow all of you to have some time to touch base around any questions or concerns around the COVID rates, return to school for kids, other things that are coming up for your groups. And so I kind of consider this more of a facilitated meeting rather than a structured meeting. And many of you I know may have attended the schools reopening safely meeting that happened last week, Thursday, where Mike Mendoza and other health department directors, as well as Brenda Dessini and representatives from RRH were all present and talking about return to school for kids and what it would look like. But so I don't want to actually go back and recap any of that unless there's specific things that you all would like to go through, because I did a quick recap on the Wednesday, the call this afternoon or at noon today. But I would just love to have you guys talk about what questions you have, what concerns. It doesn't have to be also about COVID or return to school. And I'll throw out a couple of questions that are not COVID or return to school that I just want to put out there for you. One question has come up from Elizabeth Murray, who does a lot of the media release, both for Golisano Children's and then does some things for the American Academy of Pediatrics chapter. She sent me a message today just asking, recognizing that the flu vaccine recommendations are coming out and that nasal spray is going to be included this year, what people are planning to do in our current practices so that we can sort of set reasonable expectations for the community. So maybe to, so that whatever they put out from Golisano Children's is consistent with what the community is really doing. So we don't want to have anything that's a mismessaging, a misstep there. So that's one non-COVID question I'll throw out. And then I'm just going to open it up to see what concerns you all have. What do you feel like we can be helpful with, or what can we share together that would be helpful for what you're going into right now and next month?
Well, Jay, if nobody's going to speak, I'll just say regarding the flu mist was also approved last year, but we chose not to do it because it being intranasal and worrying about COVID and blah, blah, blah. So, and I actually don't even think we're doing flu mist this year either. Nobody said, should we order it? And I don't believe that we did. So I guess I would appreciate it if the Children's Hospital didn't heavily promote the concept of flu mist, just because, especially on the backs of the recent OSHA issues, I think promoting flu mist won't be a favor to the community pediatricians.
So what you just said is what I anticipated, but I really appreciate that, Carolyn. I think it makes sense. Does anybody else have any other thoughts, or would they like to agree or comment? Liz Walsh is agreeing from Genesis. I see. Gail?
Hi, rural
Hi.
New York. I'm giving it any way I can get it. So we did give the flu mist last year because they're so trepidatious about everything, and probably this year. And I guess one of my questions is, I've got all these kids that I'm trying to monitor asthma and have not been doing spirometries, but I'm feeling really bad about that. So I'm back to doing those outdoors, but I'm wondering if we should be doing those. Also, I've stopped doing the fluoride varnishes, like the guilt's overwhelming because I don't want to get in their mouth, but are we to be doing those again? You know, I'm exhausted masking up. I mean, I'm just exhausted already. It feels like everything I do should be masked. So I really danced around the fluoride varnishes and danced around the spirometries until I couldn't take it anymore. And I'm like, whatever's going to happen, I'm back to doing them. But that would help to know if there's a consensus on what people are doing with that.
Thank you, Gail, for that. I'm going to say I'm seeing things in the chat. Other folks who have not ordered flu mist. Sorry, I'm trying to make the chat work for me. Or others who may have some, but not a lot. So not a super high priority on flu mist. Doug Bennett also not doing flu mist and not order. And this is good information for me to share with Liz. And that's exactly why she reached out, thank goodness. Before putting any kind of statement out. And so I will advise them, they won't be putting anything out that you can't give flu mist, but they're just not going to highlight it or emphasize it so as not to set up an unrealistic expectation. Clearly, Gail, for you, or I think Joanne, you said you may have a small amount, you know, it's certainly part of the recommended list. Obviously, you should be able to do it, but we just won't be actively promoting because I just think it's all around expectations, right? And right now, there's so much pushback around expectations. You don't need another thing like that. To Gail's point about fluoride varnish, I'm just curious, I do know some of the PEDS practices and family medicine practices are doing fluoride varnish. What have other people done now during the pandemic? Have you continued fluoride varnish, just using appropriate PPE when you're doing it? I'm scanning the screen. I don't want to put anybody. Carolyn, I'm looking at you again because I know Elmwood was doing
I
it,
was gonna
right?
say, we have been doing it, and I don't want to talk too much, but effective, and I'm not anti-flumist, and I think it's probably low risk, but it gets entirely to what Gail's talking about. Somehow 18 months into the pandemic, it still isn't clear to us, at least not unanimously, in our practice of what's appropriate, what's not appropriate, what level of PPP you need for whatever. So we have been doing the varnish for quite some time, and I think that nurses, when they do it, just have regular mask goggles on. The flu mist, again, was a question of, are we going to have coughing, sputtering, are people going to N95, whatever. So we didn't do that. The seminar last week, the return to school, was excellent, but still somehow there's a debate in our practice of whether NP swabs are aerosolizing procedures or not. So I emailed Brenda Tassini, who said, no, they're not. And one of our doctors recently had to have a swab at an urgent care for U of R, and that person wore surgical mask, goggles. And yet in our office, we're doing N95 face shields. There's a debate about gowns, gloves, or whatnot. So I guess to Gail's point, we're apparently still confused, doing different things, and it's a bit of a problem.
So a review, so I'm not going to say I can do that tonight because I wouldn't even hazard to jump in and say I know exactly what you should do for all those things. But it sounds like a review around PPE for particular procedures would be very helpful.
I mean, I think it would, but ultimately, I mean, basically what Brenda said is Strong is not considering NP swabs aerosolizing procedures. Our nurses, some doctors in our practice feel that they should be considered that. And if there's a great deal of sputtering and whatever, maybe. And again, as far as the nurses doing the NP swab, if they want to put on full PPE, N95, face shield, whatever, that's fine with me. But the question is does the doctor coming in the room right after that also need to do?
Oh, we've got a big echo.
It's a matter of how crazy you get with it. And I don't even know if you're going to be able to come out with a definitive thing, because if you look at the CDC and everywhere else, there's not a definitive thing. And if you ask U of R, Brenda gave one answer, and Steve Cook wasn't sure what they were doing. It was slightly different. So, I mean, I think it's just, we're all so confused. 18 months in is what I got out of it.
Okay. Well, I think what we could do is we could at least make sure that we reissue what the minimum requirement should be. I mean, maybe that's what it is, really, is what is considered at least the minimum. And if people choose, if there's difference of opinion, if they choose to do more, then they choose to do more. But I would agree with the team that there's a number of people who put in the chat there, Gail, that they are doing the fluoride varnish. I think you should go forward with that. Again, using appropriate PPE for yourself or your staff who are doing it. And I think the questions around spirometry, the questions around nebulization, I mean, there definitely was a lot of back and forth about that, right? About is that aerosolizing, is it not? There was definitely the sense that we were being told that it was not, but yet if you looked at it, it's the same thing that you just talked about, Carolyn. So I do think it's, we're 18 months into this now, we could still look at data a little bit more and refresh some of these things. And nobody has gone back through and just refreshed that piece. So I will take as a takeaway from this meeting to take it back to that team that did the original recommendations around PPE and look at minimum. And then we'll get that back out to you guys next week. So I might have missed other things in the chat. Renee, are you happening to look if I'm missing other questions or?
Folks just weighing in on their, flu mist ordering. Dr. Fryer from Finger Lakes Health says they're ordering a limited supply. Doctors Rand, Bennett, and Topa are doing fluoride, although Dr. Rand paused for a while. So.
Okay, got it. Okay, good. So what other concerns or questions do you all have right now, or ways that we can hopefully be helpful, or at least anticipate? Liz, you're muted. Hey.
Thanks, Say. So with the continued requirement for a PCR test in order to go back to school, it seems to me that a rapid PCR availability in as many pediatric offices as possible is what's going to get our kids back into school as quickly as possible. Because especially as the winter progresses, and if we're still sending all our PCR tests to Strong, it's going to start to be 3-4 days. And last year, a lot of those kids, they'd miss a day, but then their tests would come back by the time they went back to school 2 or 3 days later. And now that's not going to be the case. They're going to be missing instruction for those number of days. So given that, is there any support as an organization or some additional information that we could get about, what insurances are covering, how much they're paying for it? Like, are we going to be supporting the cost of this because the total cost is really higher than what we're going to get in return? Because that feels like the right way to do it. It's just a question of, the investment and the time to just even learn how the machine works and all those other things. On a totally separate note, our lead testing cartridges were just recalled, and we no longer have the ability to test for lead in our office.
Yeah, Liz, Carolyn just brought that up, that there was an anticipated shortage. I didn't know that yours were recalled. I apologize. I'm just going to be transparent to you all. I have been out for the last nearly month, 3 weeks, 3.5 weeks for family situation, which is better now. Most of you all know and have worked with my husband, Jeff, who had a stroke at the end of July. And so I really am, but he's doing really quite well now. So just like fast forward to the good part of the story and be like, he is, in recovery mode. But I will be totally honest, I am behind the 8 ball. And so I will jump in and try to find out more about that. I will contact our colleagues who supplied the lead Care 2 machines originally as part of the lead screening initiative. We still stay in contact with them and just see what the scoop is in terms of how long this is going to be, what's going on with that. Can other people maybe put in the chat or unmute? Have other people had cartridges recalled?
So LJ, this is Mary Beth. So
Yes.
we've had some recalled and we're just repeating those. We could look back and see which ones we used, and we'll just do them next time they come in for a checkup. We still have others available, so we're continuing to do lead testing. But I also want to comment on the question about PCR. So we got the 4-door Cepheid platform. You don't have to pay anything for the machine. You just have to sign a contract saying you'll use X number of cartridges, which is not going to be hard to accomplish at all. It's kind of a break-even situation. Maybe we make a little bit of money. It's not a big money maker, but you certainly don't lose money. You pay for the cartridges. The insurers are paying for the tests. Most people don't have to use their deductible. It comes right from the insurance if you code it with an illness code. And the test is run in 45 minutes. It takes myself or a nurse 10 to 15 seconds to pop it into the machine, and then it reads right out. It could not be easier. It is the most customer service friendly thing you could possibly do for your patients, because they come in, we do a test, 45 minutes later, we just pop the negative result on their portal with a return to school letter, and everybody's happy and back to school.
Mary Beth, that's good. That is good to hear. And that is the experience we've heard from others who have the Cepheid machine.
LJ?
I just make one comment about Cepheid?
Yes.
So there's two. There's COVID only, and there's a multiplex where you can get RSV, flu, and COVID. Some insurances are paying for one, and some are paying for the other. I think like maybe Fidelis is only paying for COVID only. So sometimes it takes a little bit of play work and find out which is which. And sometimes they're accepting different diagnosis codes. You have to play diagnosis code games of which diagnosis code they want as well. And then you just resubmit and get it. I mean, sometimes there's issues with getting the cartridges in time. Some deliveries come directly from Cepheid. So if I order 200, I mean, and there's a shortage now, of course, because there's COVID everywhere. So sometimes a little bit of a delay in getting them. So we make sure we have 100 dose cartridges in our office at one time, combination of both of them. But patients love it. We get them back same day. We sometimes run a few overnight. We use a 4-bay for COVID only. We have an 8-bay machine that we do our GC chlamydias and streps on to save room for the COVIDs. And when we run them over, I mean, busy days, we could do 30. Sometimes we do 10. I mean, so we could be doing, and we do COVID on anyone who comes who sniffles. We're telling them to come in for COVID testing. We have them drive up, do a COVID from 3:30 to 5 o'clock, get them done, get them in and out. So our patients are pretty well trained, knowing that we're going to do any sniffle, they're going to be getting COVID and maybe get back to school the next day. We do that for pre-screening for kids. We call them for checkups tomorrow. If they have a sniffle today, we might see them today for a checkup. I mean, for a sick visit, and do a COVID test. If our COVID PCR is negative and they're improving tomorrow, they're going to come in for a well visit. Then we did our screening, and I feel comfortable seeing them for a checkup. So the machine really comes in handy for getting flow in our office as well.
That's great information, Doug. I also saw that Kathleen Wani is looking at or has gotten that already, and had some information for those who may be looking at that now. So happy to have you share that, Kathleen, as well. Carolyn, you had a question about, and I think this is a question that came from somebody else too, is just about the billing and the consistency in billing between different insurers. So I think, go ahead, Carolyn.
No, sorry, we have the Cepheid, same as everybody said, we're not currently having a problem. There was some notice from MVP about what they're going to no longer pay for the COVID PCR. I think it's not starting till December, and I honestly don't remember what it was. It may be that they're not going to want to pay for the Z20.828, but they want the illness code attached to it. I'm not sure, but that would be the only thing I think for HB, to make sure if schools are still requiring all these tests, that suddenly, because the patients right now don't have any copays, as everybody said. If they start having to pay for these tests, they are expensive.
Yep. That's a great thing for us to be able to bring up to the peers that we are working with, certainly the local ones that we're working with, that we have any influence. So I just made a note of that, and we will check in, and just like we did last year, I think we updated you around which codes would work for which ones. We'll make sure that they are still covering them and that there's no cost share. Other things.
LJ, it's Teresa. I don't know.
Hi,
if you can hear
Teresa.
me.
Yes.
How are you?
Good,
So
thank you.
We also have Cepheid, and it's been working well. We actually had it pre-COVID. So we were doing strep and we're doing flu, RSV, and it seems to be, initially it was where if you're going to do the flu and RSV as well, you had to have that, they had to be symptomatic. So for the asymptomatic kids, it seems to be working well, and we do it in the office and we send them home. We have a high risk part of our office. One of the things that we're falling into now is that with all these over-the-counter COVID tests, we're not really sure what to do. And we talked to the Monroe County Health Department about it, and I wasn't able to be on the other meeting, for the school opening, but so I don't know if they're going to be accepting those over the counter. What we were told by Monroe County was that they can put it into the app and it was okay. But, so these parents are doing all of these over the counter things, and some of them are coming in to be tested, but others are not. And they're getting all these positives and just kind of going about their lives, which is a little bit tricky. But I guess, and it might just be because I missed the school part of it, but they will need PCR is what I'm hearing. And so anybody who has a positive, we should be having them come into the office to get a PCR. Certainly when school starts, because we're not really sure what to do with those. We actually had a mom who said, we talked to the health department and told them to call their pediatrician and put it into eclairs for them, that they had a positive COVID test, so we've never seen this kid. We're taking, their word for it that they were positive on the CVS test or whatever, and then we're supposed to put it into eclairs that they actually are positive for COVID, and sort of managing all of that without ever seeing them in the office. So I think that's one of our biggest things right now, is like, what do we do with all these positives that are never seen in our office?
Yeah, my initial reaction was just yuck or ugh.
Right. Yeah.
So what was discussed at length on that, in that meeting last week was that no over-the-counter test or anything other than PCR would be acceptable for a negative test. So when a kid has symptoms, that they had to have a PCR in order to assure that negative test to be able to come back in. I will be honest with you, I recall the question about positive coming up and it being a little bit iffy about whether, well, a positive could be a positive and that could be accepted. But the problem is, like, those kids still are supposed to get some kind of assessment right before they come back into school. Like, it's the whole post
It's
cardiac.
never documented by the Department of Health. Like, Department of Health has no
Exactly.
idea about any of these positives. So, like, truly, with all the calls we're getting for positive CVS tests,
Yeah.
our numbers are way higher than anybody even realizes. I mean, it's constant.
Well, and the fact that you're getting information from the health department asking you to enter that into eClaires is just strange to me. So I have to say, I got to take this one back to
Okay.
Mike Mendoza and team, because I just, that feels, I would feel the same feeling that you had, and other people can certainly speak up to, their sense about this, but it does feel to me like these kids should get a reliable test done. And they should have, there should be some clear documentation about who has COVID or not. How are they doing contact tracing them? And
Right.
know,
They're not, right? Because nobody knows
but-
about them.
okay. So this sounds like Lisa Smith just put in the chat too, that Monroe County Health Department told one of their patients the same thing. So honestly, what I will do is go back to the team that's doing the laboratory assessment and the contact tracing, but through Mike Mendoza, and just get a very consistent response from the county. The other thing is, we're not all just in Monroe County. So I don't know, for those who are not in Monroe County, what their experience is. Gail, I don't know if you want to comment, or Dr. Breen, what's happening for you all in terms of what are your health departments recommending in these instances?
We were told, this is Steuben or Livingston, we were told from Steuben that a positive rapid is a positive rapid. You can go with it. A negative needs clarification. One of the things I have is I have a lot of reticent people who refuse testing, and we're more than happy, and I suspect they'll be more than happy to be home 10 days. Supposedly the health department's supposed to clear them. I have never heard that the health department's even aware when they stay home. Like, we were not told we had to notify the health department that they refuse testing. What do we do with these outlier kind of renegades that refuse testing and will stay home for 10 days? Who's clearing them to go back? That's my question.
Yep. I feel like I have no good answers here. This is just a bit of a mess. My understanding is, from the standpoint of assessing for, once someone has been out for 10 days and they are symptom and fever free, and going back, whether they've had a COVID test or not, they are still supposed to have, they were presumed positive, right? If they didn't test. And so they're still supposed to have that pediatric or family practice assessment, whether that be if it's mild symptoms, whether that be a televideo visit, just checking in if it's a younger kid. But they're still supposed to have some assessment. And clearly for athletes, they are supposed to be assessed to be able to return to play. So I think this is a space where we didn't delve into it on that last call, and maybe we didn't because their practice is every which way, but it would be good to have some better alignment. I don't know if we'll be able to fully rein that in, because people can also refuse to come to you if they've already had their positive test done. I think it's going to be more on the issue of what happens on the schools end as these, I think there will be more enforcement of it now that kids are back in school. Just because when they're out, they're going to have to be documenting something to come back in. So that's going to be got to find out more information. I don't know. It just is, it sounds really, really messy and sloppy, and that's complicated. I think there was a question of please putting in what needs to be done in terms of reporting. And I think that you guys did that in the chat, right? Are you all messaging to Liz about that? Liz, did you get your question answered? I don't know if Liz is still on.
She's
Oh,
here.
there you are. You're blocked by I'm reading the chat, so your face is underneath that chat, so I didn't see you nodding. Sorry about that, Liz. Okay. There were a couple of things that were pointed out on that call that I think are really important to highlight. One is the fact that even though an NP swab is still considered your best, it is your best sample, right? Where you're going to be most likely to retrieve the specimen that you need for the best test, that if a family refuses or if it's not possible to do that, the mid-turbinate, not the outer nares, but the mid-turbinate swab is acceptable. Still not the best, but is acceptable. So that was one caveat that was acknowledged. The other thing that was emphasized, and I know that you all have seen this, is the notion that there is no test to get out of quarantine. That is just a nice big old myth out there that people think that they can go and test to get out of quarantine. And some of that was perpetuated, I think, early in COVID. And then definitely when we had the testing to get out of quarantine, if people had traveled, I think that really kind of messed with people's understanding a little bit. So if you have people who are saying, well, we got tested and we're out of quarantine, no, that does not exist. Someone does have to quarantine for the full time if they had a clear close contact. So that's something that you may get questions about or you may learn about, and it's important for us to reemphasize with our families. And then the other thing was the form that we developed last year in terms of the return to, you've tested a patient, they had a positive COVID test, and you sort of document any other associated risks or symptoms. That form should work just as well this year as it did before. There aren't any significant changes to that at this point right now, unless something new comes out from the Department of Health. We're really hoping there's not anything new or different coming from that space.
LJ, there was a question from Dr. Topa. Is that the one you answered? Are you all set with that one? Other family.
Dave, I think I might have sort of seen that. Other family members of those who refuse testing have to quarantine. Absolutely. Yes. That's the reason why you might want to get tested, because if you're negative, your whole family doesn't have to quarantine. But that's where it's all like the wild, wild west, right? Because I think that people are in general not following that. So re-emphasizing that again, we have asked for the county to re-emphasize that in their messaging, or the counties to re-emphasize that in their messaging, and for the schools to do the same so that people do understand how important it is to take the quarantine seriously in a suspected case like that, or a presumed positive, or certainly in a positive case.
Dr. Topa also had a question about the sensitivity and specificity of the home test, if anyone was aware of what those values would be of sensitivity and specificity.
Dave, I do not know, because there's a bunch of different ones. That's the problem. So one of the things that we had asked for the labs to do is to kind of go like URMC and RH labs to go back through and sort of look at what the reported sensitivity and specificity is, and then what really seems to happen in the field, because often it's different. That was the problem we had early in the pandemic, if you remember, because some of these machines looked like they had, they looked great, but then they actually still didn't perform to the same level of standard. My understanding is it's lower than the antigen testing, and definitely lower than the PCR testing, but I don't know those specific numbers. I think it would depend on which type it is. And there's just going to be more of those. So I almost feel like for those things, like if people are using them to, I don't know, decide whether they're getting together with family or they're going to travel or whatever, I guess that is what it is. But if they actually have symptoms, I don't know. I just feel like they should get a decent test. The question about reimbursement, the one thing I wanted to emphasize is that any of the asymptomatic testing that's not related to a close contact is still not covered by insurance. But it is our understanding that if you're testing someone who's asymptomatic, but they're being tested because there's concerns about them having been a close contact, those still may go through. The problem is, though, you're not going to test out of quarantine. So it's a little bit of a twisted thing. There was another message that just went in the chat. Laura, the quarantine. No, there is, I'm going to have to pull up the algorithm. Actually, Renee, can I ask you, if you don't mind, to maybe just shoot back to me, because I took it out because it clogged my email, just shoot back to me
This is
Uh,
Dr. Wania. I can chime in since my kids are on quarantine right now.
perfect, there you go.
And I have the health department letter. It's 10 days of quarantine.
Yeah.
And they recommend testing even if asymptomatic at day 3 to 5 from a close contact.
So that, and Kathleen, are you in Monroe County, I'm assuming?
Yes.
Okay, so that is not what Dr. Mendoza said on the call. He sort
Oh,
of said
all right.
the testing during quarantine really didn't make a lot of sense. So again, this
It
is a nice
doesn't, because
time.
it doesn't change anything,
It
but
doesn't change
the
anything that
people from
happens.
New York State contact tracing told me to, so I did.
It changes
So-
if you're positive. If you're positive, you save yourself 5 days. That's what it is. I mean, you can have 2 consecutive 10 days from last exposure to whoever you're around, or you could shorten it. That's it.
That's a good point, Carolyn. It still doesn't shorten it dramatically, but it does shorten maybe the extended quarantine. I think that's a lot of the contact tracing now is happening by state level people as opposed to by county level people. And so that's one of the things too that we asked for the county health department to look at, because I know that many of you had reported that the contact tracing is not happening as quickly, and that the information being given may not be exactly the same as what was held up as a community standard. So Kathy Hiltunen was taking that back to their team. So hopefully we'll have a little more consistency coming from them.
LJ, which document did you want me to send to you?
It's okay. Actually, Kathleen answered the question because I was thinking quarantine was only 10 days. That's what I remembered off the document. So she answered that. So I'm good now. Okay, thank you for that, Laura, for that message in there. Okay. How are you guys doing in terms of the requests for school exemption? Medical exemption, I should say, from in-person school. Are you getting a lot of those, or is that been less so? We know that for a lot of the practices that serve many of the RCSD students, there was a flood of calls for those types of exemptions. Not many exemptions for you, Gail. Okay. Good. So it sounds like for a lot of the suburban districts and maybe for some of the districts outside of Monroe County, less of these. This may be more of an issue for our city school district. Corey, you're welcome for taking that
Dr.
off your
Breen,
shoulders.
can I ask her a question?
Yes, Dr. Breen.
I have a doctor's office in Geneseo, and I'm very concerned about exposure. And I note that the state has indicated that hospitals and hospital employees, meaning their practices and urgent cares, everybody has to be vaccinated. I made a choice that employees in my office should be vaccinated. And I met with large approval, but some very unhappy refusal. And I wonder what everybody else is doing in your offices. Are you requiring vaccination or not?
Turn that to others of you to go ahead and share your experience.
This is Ed Lewis. My receptionist of 31, almost 31 years is leaving because I asked her to get a COVID vaccine. It took me 30 years to get her to get a flu shot, which she did this past year. And she said she just absolutely would not get a COVID vaccine. She thought about it and said she would, but then I couldn't ask her to get a flu vaccine and I couldn't ask her to do anything else. So after 30 years, she's parting ways.
I'm sorry to hear that, Ed.
Me too, but it's her choice. And, you know, I think, you know, whether we fall under the auspices of, you know, we're certainly not a federally licensed health center, but I am a federally licensed health practitioner. And the majority of my patients cannot get vaccinated because of their age, and she's putting them at risk. Simple as that. So you know. in the process of interviewing people.
Understood. There are some other folks who are putting messages in the chat. Dr. Breen, I realize that you can't see it. Some who are at federally qualified health centers who are required, and they are required under the mandate to have all staff and employees vaccinated, and they are running into some difficulty, just like Dr. Lewis had mentioned. The Westside Pediatric Practice just made it mandatory for all staff. And they only have one nurse who has not been vaccinated. Chad and Renee and others within HP have been kind of keeping tabs with many of you. And actually, I have to say that the vaccination rate among our independent practices and their staff is actually far higher consistently than in many of the hospital-based practices. So I think whatever you all have been doing in terms of, your encouragement of the vaccine, your conversations around it, whether you're requiring it or not, you're certainly having a positive impact on the vast majority of your staff. And I just think you deserve a lot of credit for that. I recognize that you're not under the mandate, but I have to say what Ed said is so true. Our patients, the vast majority of them cannot be vaccinated at this point yet. So there is an issue about protecting these kids. And it's not something that our adult population as a whole has certainly embraced well. And I hope that something will change in that space. We do know from the experience of some other, we did a lot of research about children's hospitals, actually, not specifically adult hospitals, but children's hospitals who went over with mandates. And as terrified as everyone was that they were going to lose all their staff, in the end, they ended up with something like a 98% or higher vaccination rate. So they really did not end up losing a lot of staff in the end. That doesn't mean they didn't lose some. It wasn't 100%. I hope that that will turn out to be the case here. I will share with you all, just because you're probably not at the hospital very often, but these protests outside the hospital have been pretty unbelievable. Hundreds of people protesting, yelling at employees as they're coming into work. Throwing things at people's cars. It's pretty rough. That's not to say that's in many ways different topic, right? But that's what our school boards have been experiencing for the last year and a half. The world is pretty
Yes.
raw out there.
LJ, if I
Kathleen?
can, chime in about, so I have no experience with the hospitals, but I will tell you, I did attend a school board meeting in Hilton because of some news I was hearing. And it does seem like there's a anti-vaccine, anti-mask organization on Facebook that's asking people to go to either the school board meetings or I think protesting in front of the hospitals. So I spoke at the school board meeting very neutrally, but obviously for masking for obvious reasons. So it'd be nice, I think the community pediatricians in their own community schools could attend those to kind of show some support for those school board members who have to really listen to this every month.
Good for you, Kathleen. And yes, I would agree with you. I think that that's important. I'm looking at, go ahead. Yep.
No, LJ and everybody, the AAP Chapter 1 has put out letters in conjunction with the children's hospitals in the 4 cities to the school boards, relaying the AAP's policy and recommendations. So, I've driven past people across from Pittsburgh Plaza. It's crazy. There was a YouTube live video of a woman at the Fairport school board meeting last week where she was so disruptive that the sheriffs were called and she was handcuffed and taken away. My understanding is she is someone who has been an activist, quote unquote, and was hoping that would happen. But yes, they're crazy people.
Well, I think that one of the good things about being a pediatrician or a family physician or a professional who works on behalf of children and families is, you always can come back to, I speak on behalf of children who can't speak for themselves. I speak on behalf of, those who can't vote, those who can't, speak for this, and this is a key protection for them. And I just think we just need to keep reiterating that, however you like to say it, whatever you like to do. And I would say staying as balanced as you can, as articulate and clear, and yet as balanced as you can is important, because the people who are pushing this anti-mask, anti-vax lobby, boy, they are just looking to rile people up. So I don't encourage any of you who, don't jump into any kind of a debate on social media, because they will really try to destroy you in your practice. It's not worth it. Look for other venues where you can. I think, Dave, you might have a different comment about that, but I certainly have seen, because I know you do a great deal in advocacy, but I do think always being above it and professional, but still always speaking on behalf of children and families is really our job. Dave Topa, you have any thoughts on that space? Maybe Dave's not on anymore.
Yeah, sorry
there
about that.
That's okay.
I was going, trying to go from the chat to the unmute button. I mean, and I haven't run into too many issues with my Twitter account or anything like that. So I just don't know if I haven't put anything that inflammatory out there, or for some reason I'm flying under the radar, for better or for worse. But so far, no problems.
That's great.
You
That
didn't
is
write
good to hear.
you didn't write the more on Mondays comment.
I did not. I'm definitely more. I think I'm kinder on my social media account than most.
We won't out you on that. We won't quote you on that when we release this recording to the public.
There's a great
I'll just say it was my wife. It wasn't me.
There's a great cartoon out there that a school board member sent me. It's Lucy from Peanuts, saying that at first experts said that COVID was spread by oral secretions and by mouth and nose. Now we know it's secreted or passed on by another part of the anatomy that gastroenterologists will take a look at on occasion.
Oh my gosh. I like that one too. All right. What else? We got about 10 minutes or so left. Other things that you all wanted to bring forward? I have about 4 or 5 things to take away from this to try to bring back what clarity is possible when I think some of this is thick as mud and it just keeps changing. But I have 4 or 5 things. Anything else from your end? Oh, Renee. Oh, oh, you found it, Renee. All right. For those of you who can see that little cartoon with Lucy,
Thank you.
Is right up there.
Thank you. My trying to relay it did not give it justice.
There's nothing better than Lucy with that big mouth
Right.
and shouting, right?
That is not one cartoon that I am sharing on my office Facebook page.
Very wise. I think that's a good thing.
And just to clarify, the school nurses have really been educated about the need to stay on task, on message regarding the need for testing, right?
Yes.
Not given the idea that we can just write a letter saying that they don't need to be tested, right?
Yes. So you know what, Dave? So that message was brought to them before the end of school year and at the start of summer school. It was brought again in this last forum. I talked with Joanne Antonacci and with Dan White, who are the district supers, and then also with the superintendents for the rest of the schools around the region. And everyone is going to highlight that again this next week, right at the beginning of school year, like that point. In addition to the guidance, like that's going to be sort of in bold because we have to get that message across. Having said that, I am sure that one of you is going to message me saying, in the first week of school or before the third week of school, such and such school district has nurses who are, telling families to do this. Go ahead and send that, because with the connections we have now, I can reach out to an individual school or reach to the superintendents and say, please, we need to change that. So I think everyone is aware. I'm trying to read in the chat, and boy, I'm having trouble here with this. Yeah, that mask request exemption about PICA, That is not the only mask exemptions. Honestly, what I am hearing from all the specialists and is that it has to be a child who is so severely immunocompromised for the most part that they would need to be out of school because of that. And I don't know if you were on the call today, but I did mention that Beth Marston, who runs the rheumatology group now, has said that she has plenty of kids who are on immunosuppressives and who are immunosuppressed, but not severely immunocompromised. But she sends them and says they need to use mitigation measures as are being recommended in school. So I think that I hope that some of the stuff that we released today, the talking points, the infographic for families, just really reiterating to folks to help them to understand the importance of the child being in person in school and the value to that child long-term will help. It's tough because people get into a certain mindset, but I think it is our job to try to educate. Okay. The ultramarathon of our efforts knows no respite. Boy, I would agree with that statement. And you all have been on an ultra marathon for a really long time. I guess it's just like we got to gear up again. Hopefully, things with the Delta surge will begin to abate a bit. The fact, as long as all of the mitigation strategies are in place in school, in our area at least, that to me, it gives me great hope. Because if you remember a year ago, we were all panicked that schools weren't going to be able to stay open, but for 2 weeks before it would all shut down. And, we do have more people who are vaccinated now in the general community. And we do have good mitigation measures planned for schools. So I hope that that's going to make all the difference. So anything else you guys want to say? I'm wondering if I can shift gears for just a moment, just to throw something out to you all, looking at something totally different. One thing we are working with a few of your practices on, and that would like to be able to really launch as an initiative in 2022. So looking ahead, not this year, is targeted work around developmental screening. I'm not sure if you're aware, but in the Children's Medicaid measure set, comprehensive developmental screening between age 1 and 3 is hitting now sort of a tier 1 category. So this is something that may become one of our focused value-based payment measures in pediatrics going forward, whether it's 2022 or 2023. But one of the things that we wanted to do is, I think we all recognize developmental screening is bread and butter, what we do, but many of us do it differently. And so we're getting alignment around what that measure will look like. Our understanding is it really is going to be in line with the Bright Futures recommendations for most comprehensive screening being done at 9 months, 18 months, as you know, like the key intervals, and then some screening done in between. And so I just wanted to give you a heads up. Elizabeth Sharp has pulled together a draft of a survey that we're interested in sending, not to everyone in every practice. We were thinking we might tap into you all as the representatives from your practices to fill this out. And what we're going to be looking at in this space is really, are you doing screening at the key intervals as a practice? What screening are you doing? We're really interested in learning about how many of you are using the Bright Futures package. I'm saying the wrong thing, but I'm just forgetting the word, but the Bright Futures template for your well child visits, which has the ages and stages questionnaire, embedded with that, or if you're doing something else. And one of the other key things we're really interested in thinking about is how many of you have very uniform approaches across your providers and how many are variable depending on the providers in the practice. And so our goal with this is, this feels like a smart and important thing to focus on. We're already focusing on it in pediatrics, but heck, after the shutdown with the pandemic, after so many of these kids missing out on childcare experiences where they may have had even more stimulation, the trauma that their families may have gone through because of the pandemic. We know that there are more and more kids who are behind. So we want to make sure that our practices are as aligned as possible with, sort of best practice models. That doesn't mean everybody has to do exactly the same thing, but it needs to fit in with the guidelines. If we do move this up in terms of a contracted measure for us, we want to make sure you guys are ready to rock and roll and knock it out of the park. And then what we also really will welcome from you is, where are the pain points for referral? Where are you having trouble getting kids in? My understanding is for hearing and vision, in most places we're doing okay. Early intervention or other resources, or even, for the older kids, getting kids into the Committee on Special Education or special preschool education is really tough. So we're going to, in this survey, it's probably going to be about 5 or 6 questions, and we'd like to send it out to you, not in the next couple of weeks where school is launching, but Elizabeth and I are thinking of sending this to you towards the end of September, and just asking for your feedback around that. So I'm just curious if that feels like good timing, and if this feels like something you all agree. I know it's something you do, and I think we want to elevate the good work you do, but we also want to build in, if we can, some advocacy opportunities, and also some streamlined resource referral if needed. Any thoughts? You put some things in the chat, so I'll look at them.
Yeah, sounds like a great idea. And Dave, Topa, as you know, does a lot of advocacy about early intervention.
He sure does, yes. So there are some good opportunities there for enhancing the services, but we're also going to be looking at what's happening outside of Monroe County and in the outlying counties as well. The other thing I did want to let folks know is that if you're not aware, the Grow Rochester, or Help Me Grow Rochester project that we've talked about at times before, that does comprehensive developmental screening sort of in a mobile fashion, either in childcare centers or preschool centers, and also now has a mobile unit, is going to be heading out from the city of Rochester. We'll have some availability in outlying areas and in the Finger Lakes region. So as I know more about where they're going to be and when, for those of you who may have some patients that you'd like to refer to them or have them be seen, their comprehensive screening is quite extensive, and they do the facilitated navigation to referral. So whether it's for a specific developmental issue, whether it's a hearing or vision issue, they receive some additional funding through FLIPS and are going to be able to reach an additional 4,500 kids. Their work had been really predominantly in the Rochester City School District until this time, and they will continue to work in that space. But we want to try to make connections for referral for you all if you have kids that you're either having difficulty getting in or ones that you really feel could use a little more advanced assessment, but not thinking so much they need to go see a developmental pediatrician, but just a little bit more of an advanced thing. So we'll have more numbers and contact information for them as we roll out this survey to you, and we'll share that information with you. Great.
Hey,
So-
this is Dr. Breen. Can I make a comment?
Yes, Dr. Breen.
A week and a half ago, the Democrat and Chronicle of Rochester had a lead front page article about the early intervention program, which is a federally funded and mandated program for early intervention for special education, speech, motor, evaluation. And our good friends at the health department or the health insurance companies rejected 87% of all of the bills that were sent to them. So people in the agencies and in private evaluation for childhood disabilities in the early intervention period are leaving the field. And there's a bill that was passed by the state legislature. Governor Cuomo's got the bill on his desk, but Governor Cuomo is not Governor Cuomo anymore. Kathy Hochul has the bill. And it's very, very, very important that the governor's office sign the bill, which requires that health insurance companies pay for early intervention. That's the key to evaluation and treatment for cognitive intellectual disability, motor, and other disabilities in the 0 to 3 age group. And everybody should be aware that this is a matter that is a confrontation with the health insurance companies who have decided to keep the money and not spend it on early intervention.
I totally agree with you, Dr. Breen. This is a really important, it's an important advocacy moment for the governor in hopes that she will sign. But it is an important thing in moving forward. I think that New York State Department of Health and Medicaid is really trying to raise this as a high priority area. Some of this notion around making developmental screening a Medicaid value-based payment measure, I think, is to elevate the need for them to be able to connect to resources and the importance of insurance reimbursement. I think this is one way of also trying to put some pressure on the insurance companies. So totally agree with you. Thank you for sharing that. Okay, we got 1 minute. Anybody want to add anything else, or do we just say good night?
I'll say something. I know
Go ahead, Renee.
I know the crazies are getting all the airtime right now, but I want you to know how much people like me and my family and so many people do appreciate everything you're doing and realize what a toll it's taking on clinicians. And I personally am just so grateful for your good work and your good spirits for the most part. And just thanks for all you do. I'm really sorry that you're going through this. I don't know how you guys don't throw more punches, but I'm glad you don't.
We just got to throw punches in the right place at the right time to benefit kids as opposed to engage. So Renee, that was an awesome way to end. Thank you, everybody. Please remember, as these kids are heading back into school, and I mean, we're working through the protocols of screening, et cetera. We also are fully aware that you have been seeing and you're going to be seeing more mental health concerns for these kids, probably by week 3, if it doesn't surface before then. And so our care management team, all of whom are on here, listening in and being present, are ready to help your practices. The behavioral health team is available, and the BHI calls on Tuesdays at 12:15, Robin? Yes, are happening on a weekly basis. And so keep in mind, that's a resource. If you're struggling with something with a kid, feel free to come in and join that call. It's a lot of great conversation and really good information that's shared, and the opportunity for additional support. So thank you, everybody. Thanks for joining tonight, and have a great night. And we'll see you probably Wednesday again with the COVID calls. All right, take care all.
Have a great holiday weekend, guys.
Yes, have a good holiday weekend. Good night.
Bye-bye.